Hi there, my name is John Johnson, and this presentation is going to be about the treatment of drug addiction in PTSD through the use of psychedelics, plant medicines also. So imagine a veteran returning home from war, and he's haunted by the sounds of gunfire, the loss of his brothers, and the crushing weight of addiction that numbs the pain he can't escape. He's tried therapy, prescription drugs, and rehab, but nothing has helped. Now imagine that same veteran finding peace not in a hospital or a traditional clinic, but in a jungle ceremony, guided by traditional healers. Using a plant medicine that Western medicine once dismissed as dangerous or taboo. This isn't fiction, it's a growing reality. Addiction and trauma affect millions of Americans every year, and according to the National Institute of Drug Abuse, over 20 million people in the U.S. struggle with substance use disorders. Many are veterans battling PTSD, and others are everyday people trapped in cycles of anxiety, depression, and addiction. So understanding how plant medicine is emerging as an alternative form of treatment helps us to see how medicine, culture, and law are changing before our eyes. So over the past few years, I have been following this field pretty closely, reviewing clinical studies, reading veterans' testimonies, and learning from mental health advocates who see promise in what's being called psychedelic-assisted therapy. So psychedelics, once stigmatized, are reemerging as promising treatments for trauma-related disorders and addiction, supported by clinical studies, veteran recovery stories, and changing legal perspectives. First, we're going to explore the history and resurgence of plant medicine, then explain how it's being used to treat trauma and addiction, and finally examine the legal challenges and reforms shaping its future. So, plant medicine is not new. In fact, it's one of the oldest healing practices known to humanity. Indigenous cultures in South America, Africa, and North America have used substances like ayahuasca, peyote, psilocybin mushrooms, and ibogaine for centuries, often as part of spiritual rituals or rites of passage, designed to heal the mind, body, and spirit. For example, in the Amazon basin, shamans prepare ayahuasca, a tea made from vines and leaves that contain DMT, which is a powerful psychoactive compound. Participants often describe the experience as emotionally intense but profoundly healing, allowing them to confront trauma and release pain and reconnect with purpose. In the 50s and 60s, the Western scientists began to take interest. Researchers at Harvard and Stanford studied LSD and psilocybin as potential treatments for alcoholism, anxiety, and depression. Some early studies showed remarkable success, and in fact, a 1954 study on alcoholics using LSD therapy reported recovery rates nearly double those of traditional treatments. However, when the counterculture movement of the 1960s embraced psychedelics recreationally, public opinion shifted, and the U.S. government launched the War on Drugs, classifying psychedelics as Schedule I substances, which meant that they were dangerous, addictive, and without medical value. And so for decades, research was silenced. Fortunately, those times have changed. In recent years, institutions like Johns Hopkins University, Imperial College London, Multidisciplinary Association for Psychedelic Studies, or MAPS, and in the Baylor, for example, have reignited serious research. Their studies have not only revived scientific interest, but have also reshaped public opinion about what healing can look like. So what does science say? Recent clinical trials have shown that plant medicines and psychedelic compounds can significantly reduce symptoms of addiction and trauma. For example, psilocybin, the active ingredient in magic mushrooms, has been shown to reduce cravings and improve long-term recovery rates in individuals addicted to alcohol and nicotine. In 2022, a Johns Hopkins study found that 2 doses of psilocybin combined with therapy led to an 83% decrease in heavy drinking among participants with alcohol use disorder. Another breakthrough comes from MDMA-assisted therapy, often used to treat post-traumatic stress disorder. The nonprofit organization group MAPS conducted clinical trials showing that 2/3 of participants no longer met the diagnostic criteria for PTSD after MDMA-assisted sessions. But beyond the statistics are stories, especially among veterans. Many veterans have described transformative experiences after guided sessions with ayahuasca or ibogaine. One Marine Corps veteran shared that after years of therapy and antidepressants, nothing had helped until he went to an ayahuasca retreat in Peru, which allowed him to confront just suppressed painful memories and released that pain that had driven him to addiction. And today, he's sober, stable, and leading a positive life. Another case involves Ibogaine, which is, let me show you those pictures there. Ibogaine, which is a root-based psychedelic used in Africa for generations. It's now being studied for opioid addiction, where it appears to interrupt withdrawal symptoms and reset the brain's reward system. Some patients report feeling almost rewired, as if years of cravings just vanish overnight. Despite promising results, these treatments face significant legal and ethical barriers. Most psychedelics, including psilocybin, LSD, MDMA, and DMT, still remain Schedule 1 substances under federal law, making them illegal for general use. However, the landscape is changing rapidly. In Oregon, voters approved Measure 109, creating the nation's first legal framework for supervised psilocybin therapy. And other states have followed suit, like Colorado, and in like cities like Denver and Oakland and Seattle have also passed local measures decriminalizing plant-based psychedelics. Even the VA, the Department of Veterans Affairs, is taking notice, supporting limited studies on psychedelics for PTSD. Meanwhile, the FDA has granted breakthrough therapy status to both psilocybin and MDMA treatments, signaling strong federal interest in their potential medical value. Still, this progress raises complex questions like who should be allowed to guide these experiences, and how do we ensure safety, accountability, and informed consent? And how do we integrate ancient healing traditions into modern medicine without cultural appropriation or exploitation? So as awareness grows, so does the ethical framework, clinical training, and policy reform that honor both indigenous wisdom and scientific rigor. So one thing to note, just this previous year, an organization known as the Reed Foundation, led by a gentleman named Brian Hubbard, with the help from recovering addicts and veterans and former politicians like former Governor Rick Perry, have presented a bill to current Texas legislature called the Texas Ibogaine Initiative, which aims to fund research for using Ibogaine to treat these disorders like substance abuse disorder and post-traumatic stress. And fortunately, just within the past few months, it was recently passed and signed, as you can see, by Governor Greg Abbott, which is amazing. Very groundbreaking breakthrough in the use of this. So to conclude, psychedelics and plant medicine have a deep history rooted in ancient traditions that is now resurfacing in modern therapy. They're showing remarkable promise in treating addiction and trauma, especially among those from whom traditional medicine has failed. And plant medicine is emerging as a powerful alternative to traditional addiction and trauma treatments, reshaping how we view healing, recovery, and the human mind. And so as laws evolve and research expands, what was once taboo is becoming a frontier of hope. And so hopefully this can address things such as like the opioid crisis or veteran suicide, and bring about like healing and connection that that society desperately needs. So the story of psychedelics is not just about drugs, it's about redemption and the rediscovery of what it means to heal, and then most importantly, reconnection with yourself and those you love.